The human lung has a surface area of nearly 70 square meters, about the size of a tennis court. It is built to filter dust, pollen, and smoke, but it was never designed for butter vapor. In the late 1990s, inside a microwave popcorn factory in Jasper, Missouri, a 30-year-old worker named Eric Peoples had a job that smelled better than any bakery. He was a mixer, the person responsible for combining heated oil with concentrated flavoring agents. 8 hours a day, Eric leaned over vats of oil heated to 100 degrees Fahrenheit, stirring in a thick yellow liquid that produced the iconic movie theater butter aroma. He didn't know that the sweet-smelling vapor rising from the tanks contained diacetyl, a chemical harmless when eaten, but devastating when inhaled. There was no burning sensation, no cough, no warning. But on a microscopic level, Eric's lungs were being chemically burned, one breath at a time. Months later, he would wake up unable to take a full breath, as if someone had replaced his airways with coffee straws. By the time he reached medical care, his lung capacity had collapsed by nearly 80%. And the only clue to his diagnosis was the faint smell of artificial butter on his clothes. Eric arrives at the clinic visibly exhausted. He is 30 years old, previously healthy, and now struggling to breathe. His respiratory rate is 28 breaths per minute. Oxygen saturation is 88% on room air. He has a dry, persistent cough and is using accessory muscles just to inhale. The medical team begins the standard differential: pneumonia, no fever, normal white blood cell count, heart failure, normal EKG, no edema, asthma, COPD. He never smoked. No history of allergies. A chest X-ray is ordered. The team expects something dramatic: gets a collapsed lung, a mass fluid. But the film is clear. A CT scan shows subtle mosaic attenuation, a pattern suggesting air trapping. But still, no mass, no infection, no fluid. If the lungs look normal, why is Eric suffocating? The toxicology. To understand what is destroying Eric's lungs, we need to examine the air he breathed every day. The flavoring agent he mixed contained 2,3-butanedione, known as diacetyl. The FDA classifies it as generally recognized as safe when eaten. The stomach is a fortress: thick mucus, strong acids, and enzymes designed to neutralize chemicals. But the lungs are not built for digestion. They are built for gas exchange. When heated, diacetyl becomes a vapor. And every time Eric leaned over the vats, he inhaled that vapor deep into the smallest airways, the bronchioles. Bronchioles are microscopic tubes less than 2 millimeters wide. They have no cartilage. They rely entirely on the elasticity of surrounding tissue to stay open. Their inner lining, the epithelium, it's delicate. The pathophysiology. Diacetyl is chemically reactive. When the vapor lands on the moist bronchiolar lining, it dissolves and triggers a caustic reaction, a microscopic chemical burn. The epithelium dies, the immune system rushes in, fibroblasts lay down collagen, scar tissue. On the skin, a scar is harmless. Inside a tube the width of a grain of sand, a scar is catastrophic. As Eric continued working, the cycle repeated: burn, inflammation, scar, narrowing. The scar tissue grew inward like concrete poured into a pipe. Eventually, some bronchioles became completely sealed. This creates a check valve effect. When Eric inhales, the chest expands, pulling the airway open just enough to let air in. When he exhales, the airway collapses slightly, sealing the scarred bronchiole shut. Air goes in, but it cannot escape. Eric isn't suffocating because his lungs are empty. He is suffocating because they are full of stale, trapped air. diagnosis and verdict, a pulmonary function test is performed. The key measurement is FEV1, the amount of air he can forcefully exhale in 1 second. A healthy adult scores 80% or higher. Eric scores 18%. He is given albuterol, getting a bronchodilator used for asthma. If the obstruction were muscular, the drug would help, but nothing changes because scar tissue does not relax. The diagnosis becomes clear: Bronchiolitis Obliterans, a rare, irreversible lung disease previously seen in chemical exposure victims and lung transplant rejection. For Eric, the diagnosis is devastating. Bronchioles cannot regenerate, the scarring is permanent. He is placed on the transplant list. He eventually receives a double lung transplant, a life-saving but life-altering procedure requiring lifelong immunosuppression. In 2004, Eric Peoples becomes the first worker to take the flavoring manufacturers to court. A jury awards him and his wife $20 million. The case forces the industry to change ventilation standards and reevaluate the use of diacetyl. But the chemical resurfaces years later in a new form. Vaping liquids, especially dessert flavors. A generation unknowingly inhales the same molecule that destroyed Eric's lungs. Eric Peoples' story is a lesson in toxicology. We often hear, the dose makes the poison. But the truth is, the dose and the route of exposure make the poison. The stomach is built for chemicals, the lungs are not. When we force the lungs to process what the stomach was meant to handle, the consequences are catastrophic. Be careful what you breathe. This has been another case file from ICU Reports. If you found this analysis valuable, please subscribe and turn on notifications. We decode new medical mysteries every week. What do you think about the verdict? Let us know in the comments below. And to watch another case where a patient ignored a simple symptom until it was too late, click the video on your screen right now. Stay safe.